Welcome to Healthcare Algorhythm. I'm Dr. Will Strimel. If you want the real story behind today's healthcare challenges and the strategies and technologies people are actually using to solve them, you're in the right place. Short conversations, clear insights, practical takeaways. Let's get into it. Welcome back to the Healthcare Algorhythm, everyone. I'm Dr. Will Strimel. It's been a while since we really dug into artificial intelligence here on the show, and I have the perfect guest today to take us back there. Chris Widmayer is a CEO of Penrod, a consultancy group where they specialize in healthcare technology solutions, specifically focusing on AI data readiness, supply chain optimization, and marketing compliance. Chris, great to have you on.
Thanks. Really looking forward to this.
Awesome. So you're working in a space in which a lot of leaders are just trying to make sense of things right now. There's lots of opportunity, but very little clarity on really where these technologies are taking us and if it is even financially sustainable. So let's just start by telling us about Penrod, the work that you're doing, and how you got into the space.
Yeah. So Penrod is a consulting company, really tech-enabled services. So we come in and do strategy, but our strategy work is around your technology stacks and the different things that healthcare systems are using to really better patient experience. So we tend to not dip too much into the clinical side. Epic's done an amazing job at that part of the market. So ours is how do we create better patient experiences, more connected experiences along that path. And so our main focus is on the provider space, so clinics and major health systems, and then also on the payer space and how we bridge gaps between payer and provider with technology. The two platforms that we do most of our work on are Salesforce. Salesforce is how we started in this industry, building solutions on the Salesforce platform. And recently, we also added into our platform Snowflake, so doing data warehousing, and then using that to enable AI, which has been the big conversation we've been having lately, is around data and how we get AI to work. And data seems to be the kind of the new oil.
Sure. Right. The gold. So tell me then, what you mentioned about, it sounds like you're trying to optimize the patient experience. What does that look like to you? And maybe just kind of talk through, as you have come into this market, this space, what do you see as the problem or that needs to be solved in the patient experience? And how have you kind of thought through how you might address that?
Yeah, one of the interesting things I think about healthcare is it's something that no matter what, we're all going to participate in at some level, right? You have different brands in this world that maybe you will or won't participate in, but the one industry you will participate in is healthcare. So I think that makes it very difficult to meet people where they're at. And so we've created a kind of a generic approach to patient experience that may work for some, but doesn't work for others. And so what we're trying to do is really truly unlock how do we work with health systems and make it so that way, depending on where you live, whether it's rural, city, we can give you the experience that you're looking for, whether that be I want to just call my provider or my hospital and make an appointment. I want to do that via chat. Even the education side, right? Maybe I'm nervous to talk to an individual about my issues, but I feel more comfortable talking to through chat or something like that, and just find individuals where they truly want to be serviced. And you kind of saw that with COVID and the blow up of telehealth, right? A lot of people are like, I have an illness. I just want to get on a call and do something like this that we're doing right now and see if I can get it resolved that way quickly versus maybe going to a hospital, an acute care hospital where you're sitting there for a long time and waiting to be served. And it's only probably a small issue. Like I just need a prescription for some short medication to get me through this 2-week period.
Yeah, so I think telemedicine and COVID is a good example, because I think with the technology, it was just sitting there ready to be used, and wow, we found this great use case for it. However, people weren't ready to use it. Well, as someone who was trying to do that, half the time you were almost like you're half doctor, half IT support, trying to just nurse people through the experience. I mean, I guess kind of come back. Sounds as though that you guys are sitting kind of in the middle of the providers and the patients. So where do you see the challenges? I'm guessing your customer, so to speak, is the health system, the provider side. Is that accurate? Okay. So what are they challenged with right now? What are you helping to solve for them?
I think one of the big things we talk about a lot is top of licensure, right? So how do we reduce the need for them to have to be spending a lot of time doing the administrative work? You just mentioned there was a time in COVID where you were a half physician, half IT worker, trying to help teach them through that. So I think a lot of it is how can we help that physician stay at top of licensure and focus on care and the bedside manner. Also, how can we really connect you to the right doctor at the right time? I think that's something that's really interesting too, that we can help to do, like actually figure out what doctor fits my personality needs and those types of things. I think the big challenge of the health system is changed too, though, a lot, right? This is an industry in an area of our of our country that hasn't really changed much in the last
Mhm.
40, 50 years. And technology is moving so quickly that the change is one, it's radically different than the way they do medicine today in some levels, but also there's a lot of patient privacy information, these things, these laws that exist that we have to also take into consideration. So it's the one industry where you're not going to see the brand new sparkling technology be installed. There's going to be a governance approach to it. There's going to be research and analysis to figure out the impacts before we actually put that in place. But I think that's what I like about healthcare is we really get to understand the technology before we just jump in and hope that it works, so we can avoid some of the shortcomings of technology when they first come out, especially in the AI world where hallucinations are simply not allowed in patient care and patient
And that is, of
experience.
course, one of the bigger concerns is how is the AI going to use it? And I actually had an interesting conversation lately in the space of AI scribes, right? These are very popular. I just don't happen to use one because of the in the nature of my current practice, but many doctors are using them. And I was having this conversation, and the doctor was telling me how, it seems like, oh, it's going to save all this time, right? Because now I don't have to sit and type. But the reality is, some doctors are spending just as much time going back and we're having to
Review it.
do everything, right? And it was like sort of an aha moment for me. So I think that gets to something I know that you're focused on is the concept of AI readiness. So maybe just walk me through that because I don't really have a framework for it. So when you look at a provider, health system, doctor, whoever, what does AI readiness look like to you? And what are you looking for? And what are the initial steps towards getting down that path?
Yeah, I think there's two places that we really focus on when it comes to AI readiness before we even think about putting a single AI agent or co-pilot or whatever into a health system. The first one is your data. Is your data in a situation where you can even make AI work for you? And I'd say for a lot of health systems, that's challenge number one. We have so many different disparate systems. This is the nature of mergers and acquisitions over the course of the last 20,
Mhm.
30 years have created multiple EHRs and all these really complicated things. How do we get to the point where we can build a golden record, know who you are, and safely know who you are through a trust layer? So once you get the data part in place, it's building out how do we roll AI out and how do we test and measure AI. And so what we're doing with our customers is setting up centers of excellence and building work streams. So different work streams will have different levels of approval. So for instance, your clinical work stream where you're actually getting in and talking about patient clinical stuff, if that's something you so choose to do, will probably have a much higher scrutiny on the work stream than maybe an educational thing that we're doing or a financial thing we're doing where it's we're just trying to collect payment or help them with payment and things like that. Because each work stream in the hospital is gonna be a little different on the level of one who owns it, but also on the level of how could this create issues for us legally, but also create issues for us reputationally with our brand. Setting that up and having a cadence and a scalable way to approach this is the best way to do it because now you set rules and governance for your AI, and then each work stream works under those rules and governance, and we kind of have a clear picture of how we roll AI out to the organization. And then the key other factor is how do you test and validate it? So I think what a lot of people are losing sight of, and you've seen a lot of studies on, is like I rolled AI out, but is it actually creating efficiencies, right? And
Eh,
saving someone
Kind of
three
to my
hours,
point, right?
yeah, saving someone 3 hours isn't truly an efficiency. It's how am I actually creating true efficiency in my company? That way, I can scale faster, and I can also have people spend more time on things that truly impact the patient and the patient experience.
You don't have to name names, so to speak, but can you give me some examples of some early successes or, things where you've kind of gone in and just at a high level implemented your platform and then what are those KPIs, so to speak? What are the things that people are going to measure that are best suited for the solution you're
I think a big one that's up and that's been coming on the last few years, and we have some partners we work with in this space also, is in the patient access center, is
okay?
scheduling. So how can we move scheduling to AI agents? So we have voice agents and chat agents that can assist you on scheduling and doing full scheduling for primary care and those types of appointments. And so now instead of needing a human to human conversation for that, you can schedule through AI agents, and now your patient access center can really be focused on the journey of your care for that particular appointment. So pre-op stuff, pre-exam room stuff, and those types of things, versus spending time with you trying to find a time in a schedule that works for you. We can do that all through AI and through voice AI too. That sounds like you're talking to truly talking to a human, not like we had 10 years ago.
Now, I guess in order to do all this, you must have some integration with electronic health records. I would imagine that would almost be, the very first steps is you had to kind of get in with the Epics and Cerners of the world, right?
So yeah, we do lots of Fire and HL7 integrations. We just kind of consider. So we have this whole kind of vision of where our platforms live, and we think that a health system really has three major platforms, operational platforms in their organizations. The first and foremost and most important that we talk about is the EHR, so your practice management software, so Epic, Cerner, Athena. Number two is ERP. So ERP is still very large in health systems. Some of the most complicated supply chains in the entire world is in healthcare. Yeah, I mean the amount of volume you're bringing in, the amount of and it's daily too. This isn't like I get a shipment once every month. You're getting stuff every day and sending this stuff to hospitals every day. So ERP is a huge part of that. The third one that not a lot of people talk about that we're kind of bringing in the picture is our enterprise system of engagement, workflow, and automation. And that's where we put Salesforce at. So Salesforce becomes the experience layer to which you interact to some of the systems through. And now it becomes truly your engagement layer and your automation layer and all those different things. And so that makes it easy for us to build these agents on Salesforce that then talk to these other systems behind the scenes. And Salesforce becomes your front door experience layer into the health system, whether that be chat channel or phone channel or any of those different channels. Salesforce is the one taking and relaying that data and operations to the other systems.
So that's okay. That's interesting. So then, dude, does Salesforce? I know Salesforce has an entity called Health Cloud. I don't know much about it. Maybe you can talk a little bit about it for a layperson. But
Yeah.
I imagine if you're now moving into customer relationship management, but in healthcare, it's as you said earlier, the layer of scrutiny has to be a lot higher. The regulatory, so to speak, the data, the protect. So I guess maybe as the company was taken, say we're going to move into healthcare, did you feel like, hey, Salesforce already has this kind of built and we're just tapping into it? Did you have to do a lot of things from scratch, kind of rebuild the wheel kind of thing?
Yeah, so fortunately for us, we were already established partner when they started building Health Cloud. So we've had some inputs into the product design. We are on the healthcare advisory board at Salesforce, so the partner advisory board. So we help drive a lot of that. One of the places that when we started the business and got into healthcare that we looked at was how do we become very regulatory smart and be experts on the regulatory side of this, so that way when we do build these solutions, and we started off, building really for mid-market type companies. Now we're in large enterprise health systems. But it's easy for the mid-market companies to kind of not realize they're committing HIPAA issues because they're new to this. They don't have the legal team that a lot of these health systems have. So we wanted to be that bridge between there. So in doing that with kind of those smaller clinical companies and building trust layers and these really scrutinized security layers where we have our own tools for audit to make sure the security doesn't allow people who shouldn't be seeing certain things to see it. We were able to take those software pieces we built and bring those to the enterprise with us. And it worked really well in the enterprise too, because even if you're a large company, you still have to have the challenges of HIPAA. You might have the lawyers, but you still need the people who are building these systems to make sure they're adherent to what your security and those things are in place. And so we have tools and things like that to help us do actual tests of our solutions and make sure that they're HIPAA compliant and those types of things.
Sure. And when a lot of times what I see when folks are building this type of stuff, the two stakeholders that sometimes get left out are the clinicians and the patients. So
Right.
yeah, maybe just walk me through a little bit on how you guys address that, think about that. I can tell you as a clinician in my cohorts, we're often on the receiving end of technologies that don't really feel like they work for us. Even one of the thoughts of the show is to try to get clinical people more interested in emerging technologies to have more of a voice. So how do you guys think through that?
Yeah, so sometimes it depends a lot on what the use case is, but a lot of times we are working directly with the physicians in our projects, and there's usually some stakeholders that are leaders of different business lines depending on what we're going through. But a lot of the time too, we're also not trying to necessarily introduce new technologies to the physicians unless we need to. So a good example is a lot of this in a patient access scenario where we build out patient access, we might build the contact center piece in Salesforce. So all your calls, your chats, your omni-channel approach from your patients is coming into Salesforce as a contact center, but we will be dispatching work to Epic for a provider. And our goal is we really don't want to have individuals in multiple systems. That's a goal that I've always had technology. How do we keep you in the system that is the most closest to you be able to do all your work? And for most providers, that's Epic. And so we're not here to compete with Epic. We're not here to displace Epic. We're here to partner and better together with Epic. And so if there's something we need a physician to do, we might take that issue that's in Salesforce and then integrate it over to Epic, so that way the physician can work that, or their nurse or so on can work that, but
Yeah.
help them understand the full flow and how the
And,
patient
for
experience
those
was.
who may not intuitively know, Epic is the largest, at least has the largest market share of electronic health
Yeah.
records, if you just go by the numbers in the United States, but there's many EHR. So what I wonder about in working with Epic, I'm just curious, for people who are thinking about building stuff, something similar to this, do you have to, or maybe you can explain the process a little bit. Do you have to really partner with Epic leadership, or simply because Epic has a whole suite of, baby interoperability capabilities. So are you just able just to go through that because Epic makes it available, go through that process, or do you actually have to develop business relationships with these large EHRs?
We tend to do it through our customers and the relationships that they have with Epic.
Okay.
So a lot and every customer's journey with Epic is a little different. So what they can do and can't do with Epic is a little different, just from maturity level of how
Mhm.
long you've been out in the system and things like that. And yeah, I do keep saying Epic because it is the largest. So we have same thing with Cerner, same thing with Athena. These are all their additional EHR systems that we work with on a pretty daily basis. Epic just is the one we see the most, so that we work with on that one the most. But yeah, a lot of times it's working with the hospital systems and understanding where their level of comfort is too, right? So what's your level of comfort of other systems integrating to your EHR. And if you have a high level of comfort, that means we can do X. If you have a lower level of comfort, we have to work around that and do Y. And so a lot of our time is spent not just understanding the requirements of what you want to do, but also the governing rules you have for uh, different systems in your organization.
So it sounds like each relationship that you have with a health system is unique, right? There is
Yeah,
probably there's some basics, but you have to really kind of
100%.
build a bespoke relationship with each one, I would guess, right?
Yeah, exactly. And
So
that's
what
what's
is the
fun about it too, though, because
okay?
each journey is a little different, right? So we get to see different health systems at different places, and that's a really enjoyable part of this, and helping them. Maybe some of them are at a place where they want to get to a better place, and so we get to participate in that, which is really fun.
And what surprised you about the journey as you've gone down this, or any, things that were unexpected, or didn't realize you could do, or wow, we didn't realize we would have this kind of effect this quickly.
Yeah, I think we're smaller partners, so I think the fact that we get to see at the table with some of these major healthcare systems, it has been really, really exciting for us. And we've done that because of a lot of product we built, right? We really listen to our customers. I think if most companies and businesses, as you started, if you just take time and listen to your customers, they're telling you what they need, what their
Yeah.
problems are, and how you can build those solutions versus kind of always coming with a point of view and a perspective. So what we like to do is really listen to you and then bring kind of our flavor to it, but continue to collaborate in that. And what that's resulted in is we are a consulting firm. We do a lot of custom solutions, but we've also built our own IP team. So we do build our own software packages.
Okay.
Some of those are on Salesforce, some are in Google Cloud Platform and other things to find small, unique areas in the market that no one's addressing. So a good example is we built a solution recently, a couple of years ago, for there was an issue with metapixels and Google Ads and all these things, health system websites. So having a metapixel on your website was technically a HIPAA breach because you're sending the URL of that individual's looking at your website on, but you're also sending their IP address. So you just sent an identifier and clinical information, even though it doesn't feel like it because it's just a URL. If it has clinical terms in there, it's clinical information, right? By
Interesting.
definition. So we built a solution to come and kind of help marketers and the patient access teams be able to still use some of their reporting and things while also staying HIPAA compliant. And it was a very niche little area that not a lot of large companies were putting investment dollars into building.
Right.
And same thing on the supply chain side. We found a really nice way in healthcare to take current ERPs like Workday and Oracle and PeopleSoft and things like that and build a solution where we're going to help with the volume issues in there and help with the match exception issues that you have. There's not a lot of companies out there who are focusing their attention on the supply chain side of healthcare specifically. Like Workday is great, but it's for everybody. Everyone can buy Workday. So there's nuances in that product that we supplement with our solution to make it more healthcare advantageous and make sure that healthcare are able to recoup maybe overcharges, recoup things like that. Whereas if you're buying band-aids and the issue is maybe I'm 2 or 3 cents, they're charging me 2 or 3 cents more. Well, that's not a lot of money for one box of band-aid, but that's a lot of money for multi-million boxes of band-aids throughout a
Right.
year.
Right. So, stepping back more like looking at the industry in general, what do you think is going to change the most in the next couple of years?
So we don't do clinical work, but I do get excited in the clinical side for what AI can do for diagnosis. I still think it's a little mature, and I read a lot about it, and I have a few friendship companies doing it. But I think that's super exciting that we can truly start to identify certain chronic disease states earlier, that we can come in and hopefully start treating earlier. I also, on the clinical side, think AI, the power of AI will also help the research side to be able to maybe more quickly develop treatments or medications to help on that side. And then on the non-clinical side, I do believe that the experience will be truly personalized. And I'll truly be able to have a personalized experience through AI with a human there, because this is that's the challenge of healthcare. Healthcare is a very, not a challenge, a good thing, but it's a challenge for AI. It's a very human industry.
It's 100% a relationship industry, right?
Yeah, and it's a very scary industry for some people too, because these are sometimes great things that we're talking about, but sometimes very scary things we're talking about. And that always being an AI is going to be complicated. Is not probably ever going to be a real thing. So how do we understand when AI makes sense to be in play versus when now I need a human? I need to have a real human emotional conversation. And my hope is that AI can take a lot of those administrative things away so our doctors can truly focus time on not only giving care, but also the journey of the emotional journey that patients have to go on through some of
Right.
their
Because
care
that's the thing
treatments.
that humans do best, right?
Yeah, and AI is never going to fix that.
So if you had, what is the one thing, if people who are listening to this, kind of back to the AI data readiness, or if you could give a piece of insight to those health systems, even smaller practices. I mean, all of us are going to have to kind of learn how to deal with this in some way. So just that, what's that first step, just to think about your organization to get you ready? And I'm guessing it has to do around with the data that you have, but if someone called you up and said, "Hey, I just need to start figuring myself out, make my business more efficient, and enhance my customer relationship or my patient relationships," what's the first or one or two things they should think about?
Yeah, I think number one is data. Like, do you have a good understanding of your data? Is your data in a place that the AI will be able to make good decisions on, or is your data in a place where the AI is going to get confused and not know how to deal with it? So an example would be if you have patient records in multiple systems or duplicate patient records in even your EHR, how do we know that that individual is just you? So I can give you a full experience. But also, if we do it, if the data is so messy that you have for some reason data cross contaminating, then all of a sudden the AI could be giving out other people's information, and that would be really bad. We always say data first is the most important, but also maybe the first few use cases that you do should stay away from any sensitive data to make sure we kind of keep. So we also look at say we don't need to do a big bang all the time. We don't need to get all of your data in a good place. Maybe we have a few three use cases that we want to go accomplish. Maybe one of them is as simple as I want to use AI as a way so people don't have to navigate my website. So we have tools that will scrape websites, and they'll take all your website information and put it into a data catalog that AI can use. And now instead of me needing to click around a physician's website, I can just say, how often is when is this physician open? Or what's the ideal patient that this physician sees? And tell me more about their experience, all from an AI. And then I go, I would like to schedule now. Instead of the AI schedule, maybe now passes you to a phone number that you can schedule that in. And so that's like starting small like that also works really well to do some deflection and maybe get people used to using AI on your site before you start to give them the things that could be a little more a little more the side of I'm getting into your specific personal data. That scares people a little bit when it's like, way too much about me. Like
Right.
we've all gone to that webpage after talking about something and we see that advertising for something and
I
it's like
know, right?
freaks us out. That doesn't work in healthcare.
Yeah, for sure. Well, man, this has been a great conversation. It's exciting stuff that you're doing. I can tell you personally, I think I speak for all the clinicians out there, that to be able to remove more and more of this administrative stuff so we can actually just talk and listen and understand and help guide patients. And that'd be a huge win. So thanks for the
Yeah.
work that you're doing, and I look forward to following it.
Yeah, appreciate the conversation. Thanks.
Absolutely. And thank you, everyone, for listening. I hope you found this enjoyable and interesting as I did. And we'll see you next time on the Healthcare Algorithm. Until then, be well.